Hello, everyone, and welcome to today's session. And today we'll be discussing the theory related to the chapter reproductive health. So, we'll be discussing the theory focusing on the NEET exam. Okay, so I will tell you the topics which are very important for the NEET exam. And we will discuss the NCERT section 3.3, 3.4, and 3.5, which are medical termination of pregnancy, sexually transmitted diseases, and infertility. Okay, this is the part 2 of the lecture. Before starting this lecture, I just want to give you one information that the images, text, and other materials used in the presentations are for education purposes only. We respect the intellectual property rights of the original creators and owners. If you are the owner and have any concerns or issues, please contact us at sathee@itk.ac.in and we shall remove the content immediately. Please note that parts of the content may have been generated using generative AI, which is experimental. So, what are the objectives of today's session? We'll talk about the medical termination of pregnancy, which is the NCERT section 3.3. MTP is also known as induced abortion. So, we will understand the legal framework and the conditions under which MTP is permitted in India under the MTP Act. So, the legal status of MTP, it varies. It depends on the country. Then we will identify the medical and social reasons for which MTP can be recommended. So, MTP is allowed in certain cases. We'll talk about that, in which cases MTP is recommended or MTP is allowed. We'll also talk about the safety issues regarding MTP. So, a lot of these abortions, they are done illegally. So, we'll talk about the risk associated to the illegal abortions. We'll talk about the sexually transmitted diseases, which is the NCERT section 3.4. Within this topic, we'll talk about the common sexually transmitted diseases like gonorrhea, syphilis, genital herpes, and HIV, also commonly called as AIDS. We will also understand the preventive measures and the importance of early detection of STDs and treatment of the STDs. We'll talk about the infertility, which is the section 3.5 of the NCERT textbook. We will understand the definition of infertility and what are the causes of infertility. We'll talk about the treatment of infertility as well. And within this topic, we'll talk about the assistive reproductive technologies available for treating infertility. Okay, so we'll be talking about medical termination of pregnancy, sexually transmitted diseases, infertility, and then summary. Okay, so let's start with today's session. So, medical termination of pregnancy, this is voluntary termination before the full term. So, if you talk about human females, the pregnancy is for 9 months. The gestation period is for 9 months. So, voluntary or intentional termination of the pregnancy, this is known as MTP. It is also known as induced abortion. And remember, this induced abortion is different from spontaneous abortion, also known as miscarriage. MTP was legalized in India in 1971. So remember this legalization of MTP in India, it was done in 1971 with strict conditions. So why these conditions and regulations were imposed? So as to prevent the misuse of MTP, because a lot of illegal MTPs are going on. Okay, so if the couples, they find out that that the girl child will be born, then they abort that child. So this is known as female feticide. Cases of female feticides are increasing. Okay, so we have the MTP Act, which prevents the sex selective abortion. Still, the cases of female feticides are increasing. And if the cases of female feticides are increasing, then obviously it will impact the sex ratio. Now, MTPs are needed when pregnancy is harmful to the mother or fetus. So, in which cases MTPs is allowed? First of all, it is allowed in case of unwanted pregnancies. Okay, it is allowed when there is a health risk to the mother as well as to the fetus. MTP is also allowed when there is an unwanted pregnancy due to rape cases. Okay, so MTPs are safer during the first trimester. Okay, a trimester is for 12 weeks. So MTPs or the abortions, they are safer. They are relatively safer, you can say, during the first trimester. Okay, trimester is for 12 weeks. Here. So question can come from here. Okay, that they can ask MTPs are safer during which period, during which trimester. And why MTPs are safer during the first trimester? Because the fetus size is small and simple procedures are done to abort the child, and abortion can be done using medicines also. Okay. Later MTPs done after 12 weeks, they are quite risky because the fetus size is large, complex procedures are required for abortion, surgical methods are required for abortion. There can be excessive bleeding, there can be infections, there can be injury to the reproductive organ of the mother. Okay, second trimester abortions are much more riskier. So here you can see this is an image showing you the medical termination of pregnancy. Here this image is showing you the abortion of the fetus. Before the full term, the fetus haven't developed yet. Now let's talk about sexually transmitted infections, also known as sexually transmitted diseases. Remember, sexually transmitted diseases are also known as venereal disease. So this venereal disease, this is a older term. So these sexually transmitted infections, they are spread through the sexual contact. Okay, they are spread through the sexual intercourse. And they are spread through body fluids, such as semen and the vaginal secretions. Now, some of the STDs like hepatitis B and HIV, they spread through blood, needles, and from mother to the fetus. Okay, so remember this. STDs, they are spread through the sexual intercourse, during the sexual intercourse, but some STDs like hepatitis B and HIV, these can be spread through blood also. So again, question can come from here. Name STDs, okay, which are spread through sexual contact also, and which can be spread through blood also. So answer will be hepatitis B and HIV. Okay, these can be spread or transmitted from the mother to the fetus as well through the placenta. They can be spread through sharing the needles as well. Clear? From mother to fetus, how does these STDs are spread? So they can pass through the placenta. These viruses can pass through the placenta. Then during the childbirth also, what happens? The mother and the fetus blood can mix during the childbirth as well. So this is how this virus can also get transmitted to the fetus. Then during the breastfeeding also, some of the STDs can be transmitted to the fetus, such as hepatitis B. Now, most STIs are curable if detected early, except hepatitis B, herpes, and HIV. So again, question can come from here. Okay, which STDs are not completely curable? So answer will be hepatitis B, herpes, and HIV. So you can note here that hepatitis B, herpes, and HIV, these are all caused by viruses. So STDs which are caused by viruses, they are not completely curable. The rest of the STDs which are caused by bacteria, by protozoans, by fungi, these can be cured if detected early. So these STDs are usually, you can say, caused by these viruses, bacteria, protozoans, and fungi, especially within the fungi yeast. Okay. Here, so that's why it's very important that these diseases should be diagnosed early. So there should be regular screening for the STDs as well. Now, though all persons are vulnerable to this infection, these incidents are highest among 15 to 24 years of age group. Again, a question can come from here. Which age group or individuals of which age group are more vulnerable to these infections? So answer will be 15 to 24. Now, what is the reason? The reason is that the individuals within this age, they are very curious. They want to try new things. Okay, so they indulge in wrong activities and they don't have enough awareness. They don't have enough knowledge about sex related issues. They don't have enough knowledge about contraceptives. Okay, so this can lead to spread of the STDs as well. So here is a table showing you the pathogens, okay, along with the name of the pathogen and what type of infection they are causing. So you can see on the left side, the type of pathogen has been listed. So these STDs, they can be caused by bacteria, viruses, protozoans, and even fungi. Yes, so bacterial diseases, you should remember this table, entire table. So STDs caused by bacteria, these are gonorrhea, chlamydia, syphilis, these are all caused by bacteria. Gonorrhea, what is the causative agent? Neisseria, gonorrhea. Chlamydia, it is Chlamydia trachomatis. Syphilis, it is caused by Treponema pallidum. Okay. HIV, it is caused by human immunodeficiency virus. HIV is also known as AIDS. Herpes, caused by herpes simplex virus. HPV, caused by human papilloma virus. So these are all viral STDs, which there is no cure for, or there is no complete cure for viral diseases. And there is no cure for HIV. HIV can only be, the symptoms of HIV can only be managed using antiretroviral medicines. And there is no complete cure for HIV, herpes, and HPV. Okay, most dangerous is HIV because there is no cure for HIV. Then STDs can be caused by protozoans also. Example is trichomoniasis. This is a disease which is caused by Trichomonas vaginalis. Then STDs can be caused by yeast also. Example is candidiasis, caused by Candida albicans. So this table is very important from the NEET point of view. Now let's talk about prevention of these sexually transmitted diseases. First of all, avoid sex with unknown partners or multiple partners. The next one, always try to use condoms during the coitus. So condoms, they are the barrier methods. They prevent the physical meeting of sperm and the ovum. Condoms, they cover the reproductive organs. The male condom, they cover the penis. The female condom, they covers the cervix and the vagina. These condoms also help to prevent the spread of the sexually transmitted diseases. And they also, they are the contraceptive methods. They also prevent the unwanted pregnancies as well. Early detection and complete treatment from a qualified doctor is essential if infection is suspected. So this is also, you can say, required. This is early detection, early diagnosis of the diseases are required so that a strategy can be developed for the treatment of the diseases. And if STDs have been detected, then complete treatment should be taken from a qualified doctor so as to prevent the spread of the disease. So there are some vaccines available against HPV and hepatitis B. So awareness should be spread regarding these vaccinations program also, because there are vaccines against HPV and hepatitis B. Now, spreading awareness regarding the transmission of STDs. So, awareness regarding you can say the STDs, the use of contraceptives, the use of condoms, okay, and awareness regarding the transmission of STDs, this should be spread, okay, among the youth. Sex education should be given in the youth, okay. Awareness should be spread regarding the safe sex practices. So this is how you can prevent the spread of the STDs. Now let's talk about the infertility. So first we will understand what is infertility. Now, couples unable to reproduce despite unprotected sexual cohabitation, they are known as infertile. So in simple words, you can say the couples which are not able to produce children despite having unprotected intercourse. This is known as infertility. They are not able to produce children. Okay, and they are not using any contraceptive methods as well. This is known as infertility. Now, what are the causes of infertility? So these are physical. They can be physical cause. Means the reproductive organs are not functioning properly. They are not producing viable gametes, or in the case of male, the sperm count is low. Sperms are not viable. They are not motile. In the female, egg is not being produced. Sometimes the fallopian tube is blocked, so there is no transport of the egg. Then congenital. Congenital means by birth. Sometimes due to some genetic disorders also, which affect the reproductive organs. This can also lead to infertility. Okay, so diseases such as you can say Down syndrome, Klinefelter syndrome, Turner syndrome. This can cause infertility because these diseases can affect the reproductive organs. Then some chronic diseases and STDs also. STDs, if not cured, they can also lead to infertility. Here, some of the STDs, if they are not cured, they lead to pelvic inflammatory disorder, in which the female reproductive organs are affected. Then, taking drugs and taking medicines, this can also lead to infertility because these medicines, these drugs, they have a lot of side effects. They can affect the reproductive cells. Then immunological means what? Okay. Sometimes what happens, our immune system, it starts killing its own cells. And this is known as autoimmunity. Usually the immune system is able to recognize, it is able to differentiate between the self and non-self cells. But sometimes the immune system start killing its own cell, its self cells. In some cases, it can attack the reproductive cells. So if it is attacking the reproductive cells, then this can lead to infertility. Okay, and there is a psychological reason as well. Infertile couples can be helped through assistive reproductive technologies. Okay, so we'll discuss about assistive reproductive technologies now. So through assistive reproductive technologies, the infertile couples, they can have children. So you can say this assistive reproductive technologies is a kind of treatment for the infertility. So here you can see this is the flow chart showing you the assistive reproductive technology. Okay, assistive reproductive technology is abbreviated as ART, and it is being done at 2 levels. Remember this. So this flow chart is very important for you. This image is very important for you. A lot of questions come from here. Yeah. So here, first of all, understand it is done at 2 levels. One is the zygote, another one is the gamete. So when we talk about the zygote, within this is included IVF, which is in vitro fertilization. Okay. In vitro fertilization means the egg and the sperm, they are fertilized outside the body in the lab conditions. And after in vitro fertilization, what will happen? Obviously, a zygote will be formed. Okay. And from the zygote, embryo is formed. And then this embryo is transferred into the female genital tract. So this embryo is transferred by 2 ways, ZIFT and IUT. In ZIFT, the embryo is transferred into the fallopian tube. In IUT, the embryo is transferred into the uterus. Then at the gamete level, what is done? Within the gamete level come GIFT, IUI and ICSI. GIFT is gamete intrafallopian transfer, means the gametes are transferred into the fallopian tube. IUI is the insemination. The sperms are, you can say, transferred into the uterus of the female. This is also known as artificial insemination. Okay, the sperms are transferred into the vagina or into the uterus. And then ICSI is intracytoplasmic sperm injection, in which the sperm is directly injected into the cytoplasm of the egg. Okay, so remember this table. Remember these 2 categories. Now let's talk about various assistive reproductive technologies. So this is very important from the NEET point of view. So let's talk about in vitro fertilization first, also known as IVF. So in vitro means in artificial conditions. And fertilization means fusion of the male and the female gamete. So male and the female gamete, they are being fertilized in the artificial conditions, which are very similar to the conditions present within the female body. So simply IVF means fertilization outside the body, okay, in the lab conditions. Okay, and these conditions are mimicked. These conditions are very similar to the conditions present inside the female body. And then after IVF, the zygote will be formed, or you can say the embryo will be formed. And then the embryo is being transferred. That's why it is written fertilization outside the body, followed by embryo transfer into the uterus or into the fallopian tube. And this is also known as test tube baby. Now what happens here? Ovum or egg from the wife or the female donor and the sperm from the husband or the male donor, they are taken and then they are fused with each other. Okay, and a zygote is formed in the lab conditions. So here you can see this is the process of in vitro fertilization. Yeah, so this is the female, you can say, reproductive organs. They have been shown to you. Okay, here this is the uterus, this is the ovaries. Ovaries, they release the egg. Okay, the first step is ovarian stimulation, where the ovaries are stimulated to release the egg, and then the egg is collected. Then the sperms are collected from the husband or the male donor, and then the insemination is done, or ICSI can be done. So ICSI is done in case of in vitro fertilization. When ICSI means direct injection of sperm into the cytoplasm of the egg. Clear? So ICSI is related to IVF, although this come under the category of the gamete, because gametes are being transferred here. Okay. So here egg is collected, then the egg is fused with the sperms through the process of insemination or through ICSI. And then the fertilization occurs and the zygote is formed. Okay, zygote will divide to form the embryo, and then the embryo is transferred into the uterus or into the fallopian tube. Now, what are the methods of embryo transfer? So after the fertilization, embryo is transferred. How the embryo can be transferred? First one is ZIFT, which is zygote intrafallopian transfer. Here the early embryo up to 8 blastomeres, this is transferred into the fallopian tube. That's why this is known as zygote intrafallopian transfer. And other method is IUT, intrauterine transfer. Means the early embryo which are more than 8 blastomeres, they are transferred to the uterus. Now what are blastomeres? When the zygote, it undergoes repeated mitotic division known as cleavage. Okay, these zygote consist of, when there is a division, this division forms the daughter cells. The daughter cells are known as the blastomeres. So the early embryo which have up to 8 blastomeres, these are transferred into the fallopian tube, and the embryo which have more than 8 blastomeres, they are transferred into the uterus. Okay, so these are the method of embryo transfer. And how the fertilization is being carried out by conventional insemination or by ICSI. Okay, now let's talk about the other methods where the gametes are involved. First one is the GIFT, gamete intrafallopian transfer. So here the gametes from the donor are transferred into the fallopian tube of the female who can't produce the ovum. The female is not able to produce the ovum due to some diseases, okay, or due to in PCOS also sometimes the ovulation doesn't occur. So the female is not able to produce the egg because there is a cyst which have developed in the ovaries. Okay, so no egg is released. There is no ovulation as well. So in some cases where the female is not able to produce the eggs, in that cases the gametes, okay, they are transferred from the donor into the fallopian tubes of the female. Okay. Both sperms and egg can be transferred into the fallopian tube of the female who can't produce the egg. Okay, but it can support the development of the embryo. Yeah, so it can support the fertilization and then embryo formation also. But the female is not able to only produce the eggs. Otherwise, it can provide the environment for the development of the zygote and the embryo. Now, it helps women who can't produce the egg but can carry a pregnancy. So this is also very important. Question can come from here. In which cases GIFT is done. Then ICSI. This is intracytoplasmic sperm injection. Here what is done? Sperms are directly injected into the cytoplasm of the ovum to form an embryo in the lab condition. So ICSI can be done after IVF. Through ICSI, fertilization can be achieved. Okay. So when is ICSI performed? So ICSI is typically performed when the male partner has low sperm count and have poor sperm quality. So in this case, sperms are directly injected into the cytoplasm of the ovum, bypassing the acrosomal reaction. So through acrosome reaction, the sperm is able to enter into the cytoplasm because the acrosome consists of the enzymes such as hyaluronidase and acrosin. These enzymes help to penetrate the egg layers, the zona pellucida and the plasma membrane, which surrounds the egg. But here, the acrosome reaction is bypassed and the sperm is directly injected into the cytoplasm of the ovum, and then the fertilization occurs. Next one is artificial insemination, also known as intrauterine insemination. Here, what is a donor semen is introduced into the vagina or into the uterus if it is inserted. If the sperms are introduced into the uterus, it is known as intrauterine insemination. And artificial insemination is done when the male has unhealthy sperms. The sperms are obtained from the donor. Here, these sperms can be, you can say, introduced into vagina or into the uterus. Then the fertilization takes place in the natural way inside the body of the female. Okay. Now, reasons why assistive reproductive technology is not being used. So you can see there are so many categories of assistive reproductive technologies. Okay. So still, this assistive reproductive technologies have not been adopted very well. So what are the reasons why these assistive reproductive technologies are not being used or why they are not so popular? First is they have a very high cost. So these procedures, they are very expensive. Okay. So they are expensive procedures and multiple rounds are required because the success rate is less. Okay, so multiple cycles are often needed. So it is not that successful. Second one is religious or moral beliefs. So there can be conflicts with personal faith or the values. Okay. So sometimes the people, they don't think it is ethical to do it because this is not the natural way. Yeah. Next one, ethical concerns about embryo creation and the storage. So is it ethically correct to create an embryo? Because it is not natural. We are creating the embryo artificially. And then we are storing it and then we are transferring it into the female female genital area or the female reproductive system. We are transferring into the fallopian tube or into the uterus. So it is ethically correct or not to create an embryo? Now, success rate uncertainty. The success rate is not much. Okay, so there is no guarantee of pregnancy and multiple cycles are required. And each cycle is very expensive. Then there is a limited access to these facilities. There is only limited institutes which are, you can say, doing this assistive reproductive technology. So they are not available in all locations also. So these are some of the reasons. These are the major reasons why assistive reproductive technologies are not being used or they are not that popular. Okay. Most important is the high cost and the success rate uncertainty. Then comes the religious and the moral beliefs and the limited access. Now there is a question. Let's discuss this question. This is a very interesting question now. So this is a NEET exam pattern question. Okay, so you get this multiple choice question in the exam. So you can get a question like this. This question is based on assistive reproductive technology and STD. So this is a combined question. Sometimes you can get question like this. They have combined the two topics and they will ask you the answer. So they'll give you the 4 options and you have to choose the correct answer from these options. Okay, so in the context of assistive reproductive technologies and STDs, which of the following statements is incorrect? So this is a statement-based question here. 4 statements will be given to you. You have to choose the correct statement. In the context of art and the STDs. So what is the first statement? GIFT involves transfer of embryo into the fallopian tube. What is GIFT? Gamete intrafallopian transfer. So does it involve the transfer of embryo into the fallopian tube? The next one is syphilis can be transmitted from mother to the fetus. Is this statement correct or incorrect in context of ART and the STDs. Okay, syphilis is a STD. Now, statement C is chlamydia affects both males and females. Is this statement true or false? Then option number D, ZIFT involves transfer of zygote into the fallopian tube. So what is ZIFT? Zygote intrafallopian transfer. So this statement correct or incorrect in the context of ART and the STD. So what will be the correct answer for this question? So let's have a look at the answer. Answer will be option number A here. This is the correct answer. Now let's have a look at the explanation. So ZIFT, also known as gamete intrafallopian transfer, this involves transfer of gametes, not embryo, into the fallopian tube. So this statement is incorrect. Okay. Here the gametes, the sperm and the ovum, they can be transferred into the fallopian tube of the female. So female is the recipient here. Okay. And both sperms and ovum can be transferred into the fallopian tube of the female recipient. And this is done in the cases where the females are not able to produce the ovum, but they can support the pregnancy. Clear? Now, so this technique transfers unfertilized egg and sperms into the fallopian tube. Okay. So the eggs are collected from the female donor, sperms can be collected from the male donor. These are transferred into the fallopian tube of the recipient female, which is not able to produce the egg, and then the fertilization can take place in vivo. Fertilization will occur in the natural conditions, and then the entire process will be natural. After the zygote, embryo will be formed. Okay. Or you can say before that, blastocyst will be formed. Blastocyst will attach to the uterine wall, okay, which is known as implantation, and then the embryo will develop. Okay, the fertilization occurs naturally here inside the body. So natural fertilization means in vivo fertilization in the natural conditions, and fertilization in the case of humans, it is internal fertilization. It takes place within the body. Yeah. Then one of the option was syphilis. Syphilis, yes, syphilis can be transferred from mother to the fetus through the placenta. So sexually transmitted diseases like gonorrhea, hepatitis, HIV, okay, chlamydia, these can be transmitted from mother to the fetus. And yes, chlamydia can affect both males and the females. Clear? So let's discuss some tips and tricks and techniques related to these topics. So this will be very helpful for you in the NEET exam. The first is sexually transmitted diseases. You should know this table again. First of all, these STDs, these can be caused by bacteria, viruses, protozoans, and yeast. So you should remember the name of the bacteria, a name of the, you can say, these diseases which are caused by bacteria, which are caused by viruses, which are caused by protozoans, and caused by yeast. So bacterial STDs are chlamydia, gonorrhea, and syphilis. Viral diseases are viral STDs, AIDS, herpes. Okay, so there are two viruses. Okay, herpes simplex virus 1 and herpes simplex virus 2. Then there is human papilloma virus HPV, and there is hepatitis B. And vaccines have been developed for HPV and hepatitis B. Now, STDs can also be caused by protozoans, like the disease caused by protozoans. This is trichomoniasis. Then yeast can also cause STD known as candidiasis, which is caused by Candida albicans. Okay. Now let's talk about assisted reproductive technologies. First one is in vitro fertilization. In vitro means in artificial conditions. Fertilization means fusion of the male and the female gametes. Now here the fertilization occurs outside the body and it is followed by embryo transfer. So this is very important to write. Fertilization occurring outside the body followed by embryo transfer. Now it occurs through ZIFT and IUT. So embryo transfer is done through ZIFT or IUT. ZIFT is zygote intrafallopian transfer, IUT is intrauterine transfer. So you should remember the difference between ZIFT and IUT as well. In ZIFT, the early embryo with up to 8 blastomeres, these are transferred, okay, into the fallopian tube. And in IUT, the embryo with more than 8 blastomeres, these are transferred into the uterus. And then the normal process will occur. In vivo fertilization, this is fertilization done in the natural conditions. So sometimes what can be done? The in vivo fertilized, you can say, the zygote or the embryo developed by in vivo fertilization. This embryo can be, you can say, implanted in the surrogate mother. Okay, this is known as surrogacy. Okay, so the embryo which is developed in the natural conditions, this can be taken out and can be implanted in the surrogate mother. Clear? So here the embryo develops when sperm fertilizes an egg in the natural conditions. Clear? And then embryo is transferred into the other female recipient. Next one is gamete intrafallopian transfer, which is known as GIFT. Here the gametes are transferred into the female's fallopian tube for the fertilization. Then next is intracytoplasmic sperm injection, known as ICSS. Here this is a procedure where sperm cells are injected into egg to form an embryo in the lab conditions. Okay, ICS is done in which conditions? When the sperm count is low or when the sperms are not motile. Okay. Now artificial insemination, sometimes also called as intrauterine insemination. Here the semen is collected from the husband or the male donor and it is artificially introduced into the vagina or in the uterus. If the semen, which consists of the sperm, if it is introduced into the uterus, it is known as intrauterine insemination. All right. So these were various methods of the assistive reproductive technologies. Okay, so you should remember these assistive reproductive technologies. They can be done at 2 levels, zygote and the gamete level. Clear? So within the zygote, you should talk about in vitro fertilization, and then you can talk about the methods of the embryo transfer, ZIFT and the IUT. And in the gamete, you will talk about the ICSI, okay, artificial insemination. Okay, clear? And you can talk about intrauterine insemination as well. Okay, so in this session, we talk about the maternal termination of pregnancy. Clear? And then we talk about the sexually transmitted diseases. We also talked about the infertility, reasons for infertility, and the treatment of the infertility. So all these topics are very important here. Question can come from here. Clear? And we have also discussed the NEET pattern-based question here. Okay, so sometimes they can combine 2 topics and they can ask you the question. Right, so this is the end of this session. I hope this session was quite knowledgeable for you. Now we'll meet you in the next session, and in the next session, we'll discuss the NCERT exercises for the chapter Reproductive Health. Okay. So we'll meet you in the next session. Thank you very much for listening.